Hello everyone and welcome back to Youthful Medicine. I am Dr. Tahir. Today we will talk about the relationship of insulin resistance and metabolic syndrome. This is an important topic because it is associated with chronic disease of obesity and many complications that come along the way. So what is insulin resistance and why do I believe it is the root cause of metabolic syndrome? How do we identify and treat insulin resistance for better health? Insulin resistance is at the core of metabolic syndrome, leading to prediabetes, weight gain, and inflammation. By identifying early on and addressing the insulin resistance, it can change the trajectory of your health. And let me explain how. Let's start with an example of a patient, Laura. She's 45. She's a high-powered executive who felt constantly fatigued and struggled with weight gain around her abdomen. She experienced brain fog, sugar cravings, and difficulty concentrating in the afternoons. Blood tests revealed she has high fasting insulin levels and high triglycerides, confirming insulin resistance. These are one of the hallmarks of metabolic syndrome. Laura felt trapped in a cycle of unhealthy craving and weight gain. She was unsure of how to break free. When she came to us, we discussed about our protocol, our 4-quadrant protocol, which also involves assessment of metabolic inflammation. I used advanced diagnostics to uncover Laura's insulin resistance and underlying inflammatory state. Her fasting insulin and blood glucose tests showed that she had elevated fasting levels of both the tests, and that was the first clue. Then we did which we call a insulin resistance index, which shows that insulin sensitivity was high, and she was having a sensitivity issue. Her lipid panels were high, triglycerides were high, and her HDL cholesterol was low. These insights helped us to design a step-by-step plan to reverse her insulin resistance. So what treatment could we give her? We started her with low glycemic nutrition plans, focusing on lean proteins, healthy fats, and fibers to stabilize her blood sugar. We also talked about GLP medications to control cravings and improve glucose metabolism. Physical activity is important, and we told her that resistance training to build muscle and enhance insulin sensitivity is important. And of course, gut health restoration. Probiotics, prebiotics to support healthy microbiome is important because it influences insulin resistance. Within 4 months, Laura was able to lose 20 pounds, improved her energy, and reduced her sugar craving. She was able to conquer back her confidence. Now, let's talk about chronic stress. The chronic stress of weight gain and inflammation was also happening. The chronic stress of inflammation, the C-reactive protein, one of the other biomarkers that was high, it doesn't just affect your mental health, it wreaks havoc on your metabolism, leading to weight gain, insulin resistance, and inflammation. And let me show how we managed stress and transformed her health. We put her on a program where we reduced the inflammation by changing the gut microbiome, the dysbiosis that was happening in her gut. She felt burnt out and frustrated and did not know where to start. Our program actually helped her to add supplements which can help reverse inflammation. That included basically everyone in my practice gets omega-3 fatty acids, vitamin D, probiotics. We give patients a good multivitamin and magnesium, and then we tailor it based on their cortisol requirements. We adjust, maybe use some adrenal support supplements as well. The bottom line is, if you have high insulin, you have high C-reactive protein, you have tremendous amounts of metabolic inflammation brewing in, and addressing this is really important. I will see you again with more videos. Thank you for listening.